here now with a client that has a knee meniscal tear. There's all different degrees of knee meniscus tears. Some are large enough that the knee becomes unstable and surgery is needed immediately. And then others are more mild and degenerative long-term chronic issues. And those are the type of clients that you most likely will see. When we're dealing with any kind of knee pathology, we have to address the hip and ideally the ankle and foot, because the whole chain is connected. But particularly when we have weakness or lack of mobility in the hip, the knee joint suffers. And so clams and side-lying hip work in general, off the equipment and on the equipment, is highly recommended. Where she's got her knees bent, her heels back in line with her sitting bones. Maybe we're using a band and we're reaching the top knee up. We're holding, we're engaging the whole back of her left hip, and then coming down about 3/4 of the way. If we can restore mobility in the hip and start to teach them to move from their hip and pelvis when they're doing things like activities in the kitchen, it is that we do work on rotation of the hip joint in a non-weight bearing position to restore hip mobility and strength simultaneously, to take stress off of the cartilage or the meniscus of the knee joint.